Hello, I'm Dan Carlson. I'm a cardiac electrophysiologist at Virginia Cardiovascular Consultants. My father is a physician and my mother is a registered dietitian. So I grew up hearing conversations about medicine, going to the hospital on occasions. And so when I look forward in life as far as what I wanted to do, I always thought about or envisioned myself doing the same thing. And I went to University of Virginia undergrad, and I graduated in the 1990s with a degree in chemical engineering. And from there, I went to the Uniformed Service University, which is the military medical school in Bethesda, Maryland. I did my initial residency training in internal medicine in Hawaii at one of the Army hospitals there, Triple Army Medical Center. From there, I was a general internist or general medical officer actually in Germany at an Army hospital there. I deployed to Iraq, and I served in the Army in Iraq, and then from there I went to Walter Reed, where I did my cardiology fellowship. I've done an interventional cardiology fellowship in Washington, D.C. as well, then electrophysiology fellowship at Johns Hopkins in Baltimore, Maryland. And so for the past 15 years, I've been practicing medicine or cardiology in some form. The conditions at which I deal with most commonly are disorders of the heart rhythm or heart function. So common conditions would include atrial fibrillation or supraventricular tachycardias or ventricular tachycardias. So abnormalities of the heart rhythm. So I might do ablations for those or implant defibrillators or pacemakers for those disorders. Some of these conditions can be debilitating or impair or impact your quality of life. So if patients are having atrial fibrillation, quite often they may feel short of breath, they may have a lot of fatigue, and they may not tolerate some of the medications we put on. So making an intervention can make them feel better, make them live better. And so that's what I believe is of great benefit, or one of the benefits that I can provide, improving patients' quality of life. With regard to deciding what treatment plan or course to take, everyone's different. So some patients want to make their own decision. They want all the information, and they're going to do all the research that they can to come up with the best decision for them. And so I try to empower patients with as much knowledge as I can give them. Whereas other patients, they want you to make their decision. And so that's sometimes tough on you. And so you make your best recommendation, and they're willing to accept your recommendation there going forward because they realize that you have a lot of knowledge and you've been doing this for a long time. So that's very humbling when you make decisions for patients. And some patients are in between. They need the information, but ultimately they're going to make their own decisions. And so when I first meet a patient and introduce myself and get to know their background, that's one of the most important things that I have to understand or figure out is what do they want? Do they want information or do they want a recommendation? You're trying to meet the patient at whatever location they're at and help them through whatever need they have. And so it's quite rewarding when you get those compliments, when you get a thank you.